to this meeting, and please note that the meeting is being recorded live and for subsequent broadcast via the council's internet site. I've welcomed you all. I mean, we've got lots of different people here on the call for different areas, all contributing to the health and wellbeing. Because there are so many of us, I suggest that we just introduce ourselves when we speak, saying who we are and where we're from, rather than going through a whole rigmarole now, if that's okay. And just a quick reminder to please keep your sound off unless you're speaking. And do feel free, if the bandwidth becomes difficult at your end, for those of you online, it's fine to turn your camera off, although I do love to see you, but that's easier until you speak. So I understand, Naz, there's a couple of apologies.
Yes, so we have apologies for absence from John Brohan, Sarah Davis, Connell. I think one is joining us electronically.
I have a couple here. David Archibald and Zena Etheridge, is that right?
Yes, David Archibald and Zena.
Thank you. And I understand we have no items of urgent business. And so, do any of the members in the meeting or online have any declarations of interest they'd like to make? No? Let's move on. Questions, deputations, petitions. Naz, do we have any?
No.
None received, thank you. Okay, so straight to item 7, the minutes of the last meeting. Do any members have any comments on the minutes of the 22nd of September? Any changes that need making? No hands up? No? In that case, I will take those as an accurate record of that meeting. Thank you all. And you will see that we have Naz looking after us now, so welcome Naz, thank you. So first, straight on to item 8, primary care access, and Owen Sloman has kindly come and joined us in the meeting physically, which is lovely. Nice to see you physically, in person. And Owen, I think it's over to you, really.
Thank you. I have any slides. Are they going to come on the screen or?
Slides.
I couldn't list an opportunity to come to a meeting in person. I'm just.
Yeah.
I can't decide.
So I think Naz is going to get the slides up.
I think that'd be helpful.
Okay. No problem.
Sorry, Chair, which item is this?
We're on item 8, primary care access. Yes, we are in this strange world where at times now we've only met people online.
Yeah.
Or different in other contexts. So it is nice to see people in person.
Also, I don't even get a perspective on something just for this one got to their head. Can you just sit?
So is there 4'6" tall or 6'5"?
Yes.
Or 4.6 inches.
Oh, no,
I
no.
mean,
Is that?
Can be a shock.
yes.
Yes, I'm afraid when some of you haven't met me in person, you'll be shocked to hear that I am 5'0" nothing. Sorry. How are we doing on the slides? Do you think you could start talking to us, Owen, and then the slides will come?
Okay.
Is that possible?
It's okay. I'll get them up myself because then they're on my.
Oh, here we are. Great.
This is on. Is it a verbal?
It's on the additions.
Once Naz has got the slides up, and you can forward on. Oh, you go ahead.
So
Forward on to me.
thank you very much. great pleasure to be with you today. I'm going to cover 3 items if I can. Primary care governance, short introduction, primary care access, and then our ongoing work to develop sustainable primary care for the future. Just as a short introduction to primary care, our general practice are independent businesses which hold contracts with the NHS to deliver primary care. All but 3 of our 35 practices have indefinite contracts, which are closed, which are taken away subject to their decision to close, to merge, or CCG action linked to a breach of contract. Typically, that relates to quality concerns. An independent care quality commission inspects practices. Positively, Haringey has the only practice in North Central London with an overall outstanding rating. That's West Green practice on the National Innovation Awards. And 3 of London's 14 practices rated as outstanding for their leadership. However, we do currently have 2 practices which are rated as inadequate, 1 in caretaking, and 2 rated requires improvement. Those practices are managed through a formal legal and governance process that reports to a primary care commissioning committee. Our role in the local team is to work with practice to improve performance, to create an infrastructure to deliver high quality sustainable care, and to work with local partners as part of the Haringey Borough Directorate. Primary care has changed fundamentally over the last 4 years. It's now more than a general practice. Practice work together in primary care networks, serving between 30,000 and 50,000 people each, led by a clinical director. Practices pool additional staff and work together to deliver shared targets. Our GP Federation has a critical role delivering primary care at scale, COVID vaccinations, and the out-of-hours extended access appointments. Moving on to primary care access. Demand has built up during the pandemic. Demand is at extraordinary levels currently. The chart I put on that slide contrasts primary care appointments in North Central London between April 2020 and September 2021. And you can see A&E attendances in the full effect over the same period. The similarity of those lines shows the impact of increasing demand hitting the system at the same time. A&E attendances are important for us in primary care as we work to improve access to reduce them. So these then are the actions we're taking to improve primary care access. And I'm going to focus on 4 of those. Telephony, the key point, we're aware that a number of patients have real difficulty in getting through on the phone and waiting long times. That is an immense frustration. In response to a very helpful and important health ops mystery shopping exercise, GPs agreed best practice principles for telephone messaging. At least 5 of them have invested in new telephone systems over the last 18 months. New workforce models, so this is new workforce models coming in as part of the primary care networks, working alongside GPs and nurses. Our pharmacist team is award-winning. Its leader, Janet Shukla, won Health Service Journal National Clinical Leader of the Year at the Recent Award, and the team was nominated for Workforce Initiative of the Year Award. I'd also underline social link prescribers, which help make connections to other services, and the introduction of specialist staff to help patients with severe mental illness. Triage, introducing and honing triage processes to understand patient needs and allocate resource accordingly. E-consultation tools have been introduced over the last 18 months with patients encouraged to use them. I'm working with practice to improve performance using comparative data, which we emphasise a lot locally. To give an example of that, one of our East Haringey practices was an outlier on A&E attendances, and we challenged them on it. They developed a process where if a patient had been to A&E 3 times in a given period, they contacted them to understand why and ask if they would come into the practice. The approach worked, we rolled it out across Haringey, and in the year ending March 2020, A&E attendances per head fell by 1.5%. And the national Ipsos Mori survey, which is across the country for primary care, had our overall satisfaction at the highest level since 2014. Now, it's not to say that everything is rosy in the garden. I think you're about to tell me, on certain terms, that it's not. But there are things that we're doing, and we believe they are having a positive impact, and it's been determined for some time. Winter access funding. You will be aware of government funding for winter to help us get through this difficult winter. And we're still waiting for final confirmation of the NCL programme. a decision has been taken to prioritise access in deprived areas. What that would mean is more resource coming in for face-to-face appointments, particularly in East Haringey, across the borough, a particular drive in East Haringey. And that's going to be very important for us through the winter. I do, however, need to pause on a disturbing trend which has developed since lockdown of abuse, intimidation, and worse of our primary care staff. And that's unacceptable in itself. It's harmful to the victims and it's a significant risk to business continuity. So about a third of our practice are now reporting concerns about not having enough reception and administrative staff on duty. And as you might see on that slide on the screen, nobody will want to hear me repeat those quotes. They're taken from 2 practices in Haringey over the last month, and we could have got other quotes. It's quite concerning. Moving forward, I think we're about halfway through the transformation in the way primary care is delivered. In 2014, there were 54 practices in Haringey. We're now at 35. With plans to reduce that number further linked to estate moves. There's a clear link between general practices, the buildings they operate in, and the workforce. And to state the bleeding obvious, it's the workforce that delivers the service. At one point, shortly after I came into role in April 2018, Haringey was 194, about 195 on the National Primary Care Workforce Indicator. We moved to 191st, and then 180, dizzy heights, 180th, shortly before merging to MCL. At that point, we had the lowest proportion of GPs to patients and the highest proportion of GPs to age over 55. And what we're finding overwhelmingly is that our younger GPs are not taking on partnership roles in the smaller practice operating from a terraced house or a converted shop front. So we need to provide a physical environment in which people will choose to work. And that's why it's so incredibly exciting that we're securing once in a generation state investment. Right now, buildings are working on 3 new health centres in Haringey that will open next year. A new building for West Green practice just south of Turnpike Lane, a new building for Charlton House practice on Tottenham High Road, and in the middle there you can see me hard at work on the new building in Muswell Hill, which will open next year. We hope we're finalising negotiations with the council and with developers on a new health centre in Tottenham Hale, which will open next autumn. We also want to launch a major public engagement exercise on an integrated health and wellbeing hub in Wood Green Shopping City, which will include a general practice. I then want to make the connection between that estate investment and a workforce investment. Many of our practices are teaching practices, and that means they're accredited to take on GP trainees who support the service, but are also then much more likely to take a post in that practice by qualifying fully. We're actually at 64% of our patients serving teaching practice now. There's an inspection tomorrow, which if it goes well, will get us up to 69%, and we will go further. That then means that we can approach an integrated care system, I think, with much greater confidence. Primary care is increasingly delivered at scale. Vaccinations, health checks, diagnostics, surgical screening. And as we look forward, we can place services in individual practices, or once in a PCN in a hub location, or across the borough. It also enables us to work more effectively with our partners. So working with the council on locality structures to address underlying health inequalities in East, Central and West Haringey. And working with Whittington Health as our main community health provider. Whittington plans to consolidate onto 4 main centres, Bronte in the West, New Green Development in the centre, Orchard Lane in the East, and Tyburn as a children's hub in the East. But we know that that can only be effective in terms of locality structures and addressing health inequalities if we connect with the community. We're immensely proud of our vaccination campaign. We were able to achieve over 80% coverage amongst our more vulnerable older age groups. We recognise that our patients, some of our patients will struggle to get to the sites. So we mobilised a volunteer driver network, which has taken over 800 patient journeys, is still active on the booster campaign. We understood that there was an underlying hesitancy amongst large parts of our population about the vaccine. to work with community and faith groups, to organise open sessions with our GP and pharmacists. Bring your questions, bring your concerns, and let's talk about them. Let's address them. And training council staff and mutual aid volunteers to talk to people about the vaccine. And also to make the service as accessible and comfortable as possible. We work with churches, with mosques, with food banks, which is incredibly important in reaching vulnerable groups, to provide clinics there. And that culminated in the happy event at Spurs, where over 4,000 people were vaccinated in a day. And I think that did three things for us. One is we saved lives. Second thing, it gives us a model to work forward on about how we can work effectively with the community to deliver outcomes that we couldn't deliver on our own. And thirdly, speaking as a Haringey resident, it's incredibly important and precious that in something like that, our community came together. And it's a member of my team who, Davina Gowan, who worked with me on the vaccine campaign, I think did it best. That's what your place is. We're all one community and we're looking out for each other. And she said that during that point, she's of Jamaican heritage, that she was inspired by their Queen out of many one people and how we work to make sure that as many people as possible are safe. Finally, I'll put some questions that I've worked up with Beverly and Charlotte. They may support our discussion about how we can work together further, but equally, there may be other points that you want to make to me. So thank you very much.
Thanks, that's really helpful. It's good to have a whiz through. But thank you also for not entirely doing getting on PowerPoint, and then the people will have lots of questions they want to ask. It's great to have lots of time to do that. So I think it's useful to, we will address those questions, but I'm going to open up a little bit and then come back to some of your questions. Well, I've got Anne. Anne, you've got a question.
Thank you very much for that presentation. It was really helpful. And I think the questions at the end will be helpful for us to get to. I think I've got a bit of a response to the first one, but it does about how the aggression and frustration of people, or the, and I think that is looking at the points of frustration, but maybe we should ask that as a group. My points to the presentation are about access to the face-to-face contacts and the access to GPs, and what are the lengths of time after which it should be required that you do have a face-to-face appointment. I say this because for children and young people, we know that sometimes fabricated illnesses that they are the victims of can take place through repeated medication. I remember a serious case review in another place that I worked in, whereby the GP was administering medication without seeing the child and family, and that was seen as not best practice. And now that we're in this we're working through COVID, and it's become normal not to have face-to-face contacts. How long should it be before we see a child or young person before medication is repeatedly prescribed? I wanted to hear a little bit about the use of pharmacists. They too might be able to help with the points of frustration that people feel, and maybe you could give us some information, an update on that, how they link with this system, and whether the data and the increase in requests for appointments could be broken down by age. Is it possible for us to see, is there a demand for the under 18s? We know that there's a lot of demand on our A&E departments, and that children and young people, are, I use the word overrepresented there. Is there a link between, are we seeing the same demand through GPs? Thank you very much.
Thanks, Anne. There's some really good questions there. Do you want to take a few, Owen? Or
I think so. I'm conscious that our clinician is online, so we have a general rule that a clinician answers a clinical question. I think the first question on when is it appropriate to see a patient face-to-face, Peter, I think you should probably take rather than me. Would that be okay?
Of course, yeah, absolutely fine. I think it'd be fair to say that the clinicians working in Haringey all the way through the pandemic have been tussling with this question. As you can imagine, right at the start of the pandemic, when we were instructed by NHS England to move as much online as we could do, all the practices that I'm aware of were still seeing some patients in the practice. And this, of course, was very difficult indeed in terms of the risk of transmission of the COVID virus, but also the risk of missing some important clinical signs that could only be picked up by seeing and examining the patient. As we're coming out of the pandemic, the same problem in a way still applies because as we all know, there is overwhelming demand and only finite capacity. So I'm sure that in every practice, that certainly talking to the clinicians, they all are asking Anne those very same questions. You know, for those people who have just received a repeat prescription during the pandemic, which ones should be brought in for a face-to-face examination? So there is a real tension in the system. There is a tension between the public, who are asking to be able to book a face-to-face meeting with a clinician and have the right to do so without being triaged. And then we have the finite capacity of the system with the clinicians looking at the demand and trying to work out where best to place those face-to-face consultations, with whom, about what. And that is very difficult. And that you know, Owen was mentioning about the frustration that practices are meeting, and of course this is one of them. This is absolutely one of them, where the public are clamouring for a face-to-face consultation, are resentful at being triaged and being asked, you know, why they want to book a face-to-face. I think clinicians similarly are also exercised and anxious about people they are aware of. And let's face it, Anne, during the pandemic, one of the big concerns I picked up from my fellow clinicians was around child protection during the pandemic, you know, about doing video consultations, phone consultations, when you were not able to see who else was in on that consultation, who else was present in the room. That was very worrying for the clinicians. So I think as we're coming out, I think it'd be hard probably to draw up hard rules about, you know, how many prescriptions before somebody is seen. That's a bit of a tough one, I think, really. I think this is probably something that each practice will have to discuss in-house and decide how they best go about doing it and what they think is best clinical practice given the finite capacity of the system as it stands at the whole. I hope that's helpful.
Thank you.
Thanks.
Would we be able to have a response back to what decisions they've come to? I'm mindful of some things to do child protection that can only be seen through the GP lens, such as fabricated illnesses, but I don't need a response now. It's just be helpful if we can maybe talk outside at another meeting. Thank you.
Love to, yeah.
I think that would be useful. I think the point you made, Anne, is really clear, and the importance of that and of our own concern about our children and young people and beyond, actually, to our more vulnerable adults as well. So I think it would be good to have a question as that's possible.
Do you want me to take Anne's other question?
Yes, please. Pharmacists and then
So answer your question, second question, and I don't have information on pharmacists, but I'll link into my colleague in the medicines management team to see if they're picking up similar intelligence and frustration. On the age breakdown, I'm not sure the primary care access data is always a bit difficult. A&E data though is more robust, so we will have that. There's a significant issue with children being taken into A&E in North Middlesex. And one thing we want to do with our increased access capacity in East Haringey is to increase provision specifically for parents and children to help manage that demand and that anxiety through this winter.
And I might just add an additional to that, Owen, which is I wonder if you or someone else on the call would reflect on to what extent some of that might also be people who are not registered GP and giving access to the services for their children. Giving access to
It may well be. If we can, I think there is data where it reports from North Middlesex whether there is good practice. We put successive councillors have asked us to prioritise that agenda. We're actually leading practice on safe surgeries in terms of welcoming patients to our papers, but there is of course an issue. There'll be some patients who just won't. So yes, we'll pick up.
No, and of course I know there's been a lot of work done on that, and I'm very supportive of that. But still, we do have feedback from organisations who work with migrants and refugees in the borough that say that there's still many of their people they see who are in that circumstance aren't quite getting there. And I think, especially what happens is if it goes wrong with one practice or with one individual, it breaks down that relationship. They don't go onward to try somewhere else. For instance, so I think it's still an area that we need to focus on. It's certainly something that I've been lobbied on several times about with the relevant organisations who work very closely with people in our community. Conscious of time and lots of questions. Lynette.
Just looking for that button. I just wanted to basically reinforce what Anne was saying about there are particular groups where it just isn't good enough that they get a repeat prescription. Obviously, at Mind in Harringay, we often, definitely during different periods of this pandemic, we've heard people having trouble even getting their medication, let alone getting a review of it to see what the effects are. So absolutely we agree with Anne that there are groups that need to be seen for those appointments. Sorry, I don't know if we do want to broach some of those questions that you had, but if I could just add quickly that as soon as I saw that feedback that you presented to us in relation to that theme of people being intimidated and aggressive behaviour, it spoke about the way that we communicate anyway, doesn't it, in all the different work that we do. I mean, realistically, there is going to be a lot of frustration because people can't get the appointments that they've got. And I suppose when they do get to a doctor's surgery, if that's what that example was giving, I think it's the way that we appreciate what people have been through. So for me, it was, okay, that speaks to some kind of training around how people may present after being or periods of lockdown. So yeah, somebody could go to the doctors and say that they put on weight, and maybe they didn't want to hear that all of us have. Do you see what I mean? So I think that there might be some training need there. We've already heard about the fantastic work from the community in reaching some of those outcomes when we were on the journey initially of vaccination and hesitation, etc. And I would say that the way we communicate the difficulties that GPs are having is probably something that we're not doing very well and could easily be done again via that kind of community network that we've now built up. So if it is that GPs are going to be able to see people for a while or have to prioritize, I think the more you share information with people, the more that they can try and appreciate and understand. That's the kind of take that we've got at Mind in Harringay. The more you inform people, the less frustrated and angry they are when they turn up here. So I just think that the pharmacists, the networks we've already built up could probably address some of those questions that we've got or had at the end of that presentation.
Thanks, Lynette. And I think those are really thoughtful comments about what happens when someone arrives somewhere, what they've been through and what they've experienced. And I think that applies to all of this, because in one way or another, we've all been through some stuff of late and don't see that picture when people when they immediately present, plus everybody's stressed trying to do the job. So I think those are really thoughtful and powerful, and I'd expect that from you. So thank you. I can see that Rachel, there's quite a few people want to come in, but I wondered if Peter and Rachel wanted to come in response to some of those. If you do, maybe I'll bring you in, and Will as well. So maybe Peter, Rachel and Will, if you want to respond to the questions we've already been discussing.
Yeah, I just wanted to say about children, the feedback I'm getting across North London is that all the GP practices are seeing lots of children as they would expect to at this time of the year. I mean, in all my 30 odd years as a GP, every winter was characterised by seeing lots and lots of children, hot, febrile children, coughing children. So in a way, what we're seeing that the GPs are all busy seeing children, but so are the A&E departments as well. And again, I think this to me is characterised by the fact that, you know, that we've had really 2 winters where the children have not had their usual quota of viral illness. And so we have parents, beginner parents, who have not yet built up a repertoire and experience about managing these and at what point to ask for help. And I really sympathise with it. I mean, many of us remember, maybe some of us still are looking after small children, and the anxiety it provokes as well. And this is why I've been very keen that we look at the provision over the weekend, something, a lower level of provision to examine children who are just hot, coughing, febrile, whatever, to tide anxious parents over the weekend. That would be a big help, I think, anyway. But also, going back to the point that Owen was making about the level of frustration, I completely sympathise with the population. I really do. It's been a terrible time for 2 years. The population are on edge, anxious, uncertain about the future, and their routes to getting reassurance and some sort of comfort have been somewhat restricted by the finite capacity that we have. So I've got every sympathy with them, while at the same time, of course, I'm so worried about our staff who have had a very difficult 2 years, and it's not nice being at the receiving end of frustration. Thank you.
Owen, you were indicating you want to come in on that.
Yeah, I just wanted to come in with a sort of couple of of an anecdote. When on Friday I was in Muswell Hill practice and talking to the staff about some experience they had, and there was a reception manager there had a sort of bunch of flowers. There was a bunch of flowers on the desk upstairs, and she described them as dirty flowers. I didn't know what she meant, and what she explained is a man who come in and been really very, very aggressive, and then comes in with a bunch of flowers a day or so later, as though that makes it okay. And I think we just need to realise it's not okay to treat people like that. The analogy in her mind was of domestic violence, to somebody being abusive in that situation, buying a bunch of flowers. No, it's okay. And it's a real concern for us. I think it's a real concern in the service.
Yeah, and I think I'll probably speak for everyone in saying that that's absolutely not acceptable. And those of us who've been working in all sorts of different spheres of the public, we've seen, certainly I've seen it even in my own personal casework, people are under a lot of pressure, but that doesn't excuse or allow or enable or make it okay that they come in and behave in those ways, because we're all trying to do it. It's actually quite hard for all of us at the moment for all sorts of different reasons. So I just wanted to acknowledge that. I think it's really on behalf of the Health and Wellbeing Board. I think we're really strongly acknowledging and recognising what you're raising, which is that people really should not be facing abuse like that in their day-to-day work. So thanks, Owen. Will, you've been waiting around, and Rachel, Will, did you want to come in on this topic?
It was a separate comment, but I'll come in because I think it's kind of related, and I actually wanted to steer some of our thoughts to the kind of future as well. So firstly, many thanks, Owen, for the presentation. I actually wanted to say how positive it is around the securing of these new primary care buildings, because I actually think that is really, really important for the borough, and I know how much work has gone into it, Rachel, Owen and the team. So I do think that's a really fantastic development. I think that having a good primary care system, whatever that looks like, it doesn't just include GPs and GP practices, is absolutely fundamental for the health and well-being of our residents into the future. And there are some real opportunities to think about what that looks like. We're under strain, we're really under strain, but actually we've got to do some strategic thinking. I know there's lots of work around neighbourhoods, primary care networks, how we target particular conditions, how we engage with communities, not just on COVID, but things like mental well-being, how to keep healthy and well and stop smoking. So there's huge opportunities here, but we need to, as well as focusing on the immediate issues, we do need to have space to think around those longer term issues. And those new buildings do give us a good platform actually to think about that, and the localities work we're doing in the council as well.
Thanks, Will. And you're right. We can see lots of potential there. It's very positive actually, and to see that inward investment in borough. Rachel.
So So just really quickly, I just wanted a little bit of kind of data around what we're talking about. The GPs are still seeing over 50%, so I think around 52% of appointments are face to face. And when I've talked to GPs about children, and we do that a lot because of the pattern at North Mid, where essentially the increase of attendances at North Mid has been driven by minor conditions. So we haven't seen admissions going up, we've seen attendances going up. And so it's around sort of 30% of attendances are minor A&E attendances, and the majority of those are children. So it's 0 to 9-year-olds. So we've talked a lot to primary care about whether people are seeing children enough face to face. And I think what we hear back is just exactly like Peter says, that people have a very low threshold for seeing children. You know, if parents are anxious, that is a threshold for seeing the child. Do totally get your point, Anne, about the repeat prescriptions, but you know, we've talked as well to the Federation, who run the extended access hubs, who have all done two things. One, repeated that point about the low threshold, and the second is really converted, sorry Cassie if this is what you were going to say, but have converted to seeing higher proportions face to face out of hours. And we're really focusing our energy on what do we do to really support anxious children and families. And it's a bit to Will's point about kind of what could we do more of in future? How do we harness our health inequalities, work around this? We've got a few really good initiatives. So we've got North Mid are running an initiative where paediatricians come out and talk to parents and families where they've had high A&E attendances. Lynette, I really like your idea about using our community network more, key messages, working with people. We've built into our health inequalities funding, we've built in some capacity and capability to do more engagement. And the tricky thing that we've got, which we can't sort of get away from, is that the main indicator of high A&E attendances is how close people are to North Mid. So it doesn't correlate to kind of just how easy it is to get hold of people in the practice. We've got practices that are really quite elsewhere in the borough where people might struggle more to get hold of the practice, but their A&E attendances are lower. So we need to really do interesting work, I think, to support our parents and families who live really kind of close to North Middlesex, around kind of prevention, that kind of information and support. As Peter says, it's anxiety that is driving the A&E attendances at the moment.
Thanks, Rachel. And some of that information is really useful, and I can see how that would really inform our local work. So thank you. I'm going to bring in Councillor Brabazon, who's been waiting for quite a while, and then bring Cassie and Peter back in.
Okay. Thanks, Cecilia. First thing I want to say actually is a personal thank you to Owen and the GPs and all the health people, because I think you've been phenomenal. Whatever the issues we're talking about, I think you've been absolutely magnificent over the last 2 years, and for myself and my family, I just want to say thank you, personal thank you. But moving on, Owen, a little parochial thing on your clinics that you mentioned on your slides. Unless I didn't see it, can you just confirm that the one on Green Lanes is actually going to happen? Because that building is almost finished now. I just can't remember the name of the building. It's all this old age is crap. And if you can just remind me, you know where I mean on Green Lanes, there's a new block that Clarion are building on the ground floor, supposed to be a GP practice. That's just a parochial question. Secondly, I wanted to ask a couple of questions about whether GPs in the borough are retiring. I mean, we're seeing a lot in the press, obviously, about people who've just said they've had enough and they're exhausted and the pressure and all the rest of it. So is that impacting Haringey? And that leads my next point. Are we going to see any more of these private companies like Centene, or are we now going to revert back to our normal situation of how we work with GPs, and I think I would really appreciate that, because that caused loads of anxiety locally about going to an American corporation. That was not well received locally, as you know. And regarding the issue we've been talking about children, I just want to follow up from Will. I agree. I think that this is a really big moment for people to rethink how they work, because there's listening yesterday to all the public health interventions around early years, in particular around Start Well and the Healthy Start, and the improvements in health visiting, and our own review of early years that we're doing. I think we've got lots of opportunity here to think, to have a much more outward looking approach to working with children and families, and getting people to do all the preventative things that they can do, and using, we have a very strong network of early years provision when people are their most anxious. I think 0 to 5s, I think, is when you're most anxious about children and their health, really. And I think that we could continue and need to continue developing those links and that outreach and that confidence building, using all those networks that we have between us and our very strong network of providers in the early years, both through the local authority and voluntary and private groups, to ensure that we support parents about understanding those anxieties and so on. I mean, none of us is immune from that, and your first instinct is to go to a hospital. I think it is, really. But if we do support people who have had 2 years of worry more effectively through those networks, I think that would pay a lot of dividends. So I hope we're going to include that in all our reviews and plans going forward. And equally through the SEND strategy, which we're coming up to talk about after this. Thank you.
Thanks, Nina. Got a few points.
Well, thank you. Firstly, thank you for what your message to us. It's very humbling, and we've done our very, very best. Thank you. To answer your first question, the answer is yes. That building across Clarion, underneath Clarion, former Horsley Place, will be a GP surgery and will be open from next April. The practice moving into it is the only practice in North Central London with an outstanding CQC rating. And it's so exciting how good they're going to be. They won National Innovation Awards for some of their informatics. And there's going to be a room in that surgery with reinforced walls for IT screens. So how good is that surgery going to be in 5 or 10 years' time? Answer your second question is yes. GPs are retiring and they're not cutting down on sessions. So at the end of September, 3 GPs retired, between them over 100 years. I asked a member of the team to do a check for me today, and actually there is one more whole-time equivalent GP in Haringey than there was a year ago. So 162 as opposed to 161 a year before. And that reflects recruitment to replace them. So we need to be clear, this link between teaching practices, buildings, workforce is fundamental to having a sustainable primary care system going forward, because the generation currently here are coming to the end of their careers. And then on the children and families, I felt that was mainly addressed to Will. Will, is that probably a point for you? I don't think I've missed any of that Councillor Robinson's other points. No?
Will?
Yeah, I don't. There's not too much there. I think I agree. There are some opportunities. I think it's probably more of a comment from Councillor Brabazon and about that kind of way that we work in the future. So not going to go into huge detail on that, but agree there are opportunities.
And that's the point that laid down to us as well. How well we work together on prevention and early help. How well we make our system work together. How well we are in our communities working together, cooperatively, collaboratively. That will pay dividends for all of us. So then that's also the challenge, and I know that's the challenge we're going to come in and on and talk about what we've been talking about in discussions around the integrated care partnership locally. That is our core aim, but also our core challenge. Cassie, you've been waiting on Charlotte for quite a while, so I'll bring you in, and then I know that Sharon has a question.
Thank you. So yes, just to make sure everyone knows me, Cassie Williams, Chief Exec of the GP Federation in Haringey. 3 quick points. The first, in relation to children. So one of the pieces of work that we've been asked to develop for this winter period, particularly in the East, using some winter access funds that are focused on health inequalities, which is why the East, is that we're going to set up some weekend child clinics and maybe some evening children's clinics. We already do see children in our extended access clinics, and it is all under 6s are all face-to-face now. And as Rachel said, increasing with the adults as well, but all the under 6s, it's too risky to do anything else. But I'm quite excited with the pilot that we're really going to do, which is we want to recruit some new GPs to work evening and weekends, but to provide them some additional training and upskilling, really to think about best practice around supporting younger children. Obviously, they're all skilled GPs already, but there's always more you can learn, and we can potentially have some development sessions with paediatricians, but also with the ABC parenting work that's happening from North Mid. I think there might be some real opportunities and some good synergy there. So we'll really work on that. I have to say, the one of our big challenges is workforce at the moment, and it isn't, I mean, as Owen said, yes, the GPs are retiring, but from what I've seen, most of the GPs retiring are retiring at an appropriate age. These aren't 50-year-olds retiring, and obviously we know at some point people need to retire. I think our bigger challenge is people are really exhausted, and so people are wanting to do less sessions. People don't fancy saying, I know what I'd like to do this weekend. I'd like to have another 10 hours of seeing patients. And that is a real challenge. And also a huge challenge has been, I keep having practices write to me saying, our GP would like to go on a week's annual leave. We don't have other doctors in the practice and we just can't get locums. So this is a huge piece of work, mission critical. We have to keep developing the workforce, really thinking about how we bring workforce into the East, etc. So it's a long process, but I think there's some really important stuff. And the last quick point I was going to make was around non-registered patients, and absolutely right that this is an ongoing challenge. One opportunity that we'll use, and I think we have to keep thinking about it, but we're going to be doing some work with North Mid, both Enfield and Haringey Federations and North Mid working together to get some additional general practice at the front door. And one of the things we will make sure is if a patient isn't registered with a GP, that they can get registered at that point. Also, our extended access hubs, they always register people if they're not registered. So just some thoughts, but we've got a long journey ahead with lots of challenges.
Thanks, Cassie. And that sounds key to me, that when people are presenting, that then we wrap them into the system and make them feel comfortable, make sure they feel welcome, and like they can access services locally when they go back home. That just sounds like a really important thing to be doing. So that's good. Great that you are, Charlotte. And then I'm going to bring in another question. And I can see Richard and Peter might want to come in again.
Yeah, thank you. I think I'm slightly dipping in front of Peter here. Apologies, Peter. I hope that's okay. Thanks very much, Owen. And I think that sort of looking forward piece, as Councillor Babson was saying, we're doing a lot of work on early years, we're doing work on localities, and really thinking about how primary care is a sort of building block of some of this work. And I suppose I was just briefly, because I know we've got lots of other things on the agenda, really thinking how do we really conceptualise primary care as part of our ICS development work, so really clear about how locally we want to interact with primary care through the local care partnership, as well as thinking about an ICS level around that. So really just mindful of our sort of relationships with primary care at a local level from a commissioning perspective. Thanks.
Thank you. And just a quick reminder, everyone, do make sure you've got your sound off, please. Getting a little bit of background experience there. Peter, and then Richard, and then Sharon, and then Mike.
Yeah, I just wanted to pick up from Willa, who I think was trying to nudge us in a slightly strategic direction. I think we would all get, I think, rather depressed over the meetings, the upcoming meetings, when we come back to visit access to primary care, because, and I don't want to be negative or even appear even remotely laissez-faire, but there is no immediate solution to this. I know I've said this in other meetings, that there aren't shed loads of new GPs waiting in the wings to dash forward to jump into the trenches. We're in for a difficult winter. I think everybody is acknowledging that. It's certainly in the national press that we are facing a difficult winter. I understand that Jeremy Hunt MP is going to lead a committee in the Commons to discuss the future of primary care. So, and I think primary care has been very much in the media spotlight, and I think it will continue to be in the media spotlight. So I think maybe what we need to do is to try and pull together and follow up on the various things that we're trying to do, and keep our fingers crossed that we get through this winter and into spring, when maybe we can draw a bit more breath and look and see how the ICS is developing and how we're all working together. That's my personal view anyway.
Thanks, Peter. Richard.
Thank you, and my apologies for being late. Richard Gourlay, Director of Strategic Development, North Mid. I mean, so we have seen high numbers of paediatric attendances at the hospital over the past few weeks. It seems to have grown in a step way more recently, but certainly very supportive of colleagues and all the support that people are putting in place. So that the work that Cassie's already referenced about additional support at the front door is really imperative and really important. I very much take on board that actually the workforce is not out there. So even if the money was there, the workforce is a real challenge for us. And I think we'd be really supportive of doing some external training and development. I think, you know, we just need to be conscious of the pressure on clinicians' times here in terms of when we can deliver that. And that, you know, as we go into January, February, March, that may not be the best time, but if we can keep that going for next year, I think that's a really important element. I think kind of taking it to the kind of Peter's point about kind of a bit of a longer term, that things like the ABC parenting scheme that we're leading is, I think, is a really prime opportunity for us to try to change some of the behaviours of why people come to hospital, and give parents confidence about managing their children, not necessarily going to primary care or secondary care, but with community pharmacies, etc., or just providing care at home. So I think that's another feature. I think the last bit I would just reference is some of the work that we're trying to do with schools. And getting into schools partly from a kind of workforce, thinking about future roles in the health service, but also clinicians talking about access to secondary care services or coming to A&E when you need to do that. And so we start to try and influence at a young age, kind of 11, 12 upwards, so that can have an impact then when those kids go back and talk about it, hopefully over the dinner table sometimes with their family. So there's a real kind of real immediate short term as we face a really difficult winter, and it is going to be a challenge for us all without a shadow of a doubt. But I'm really heartened by the kind of coordinated efforts that everybody's putting in, and then some of the kind of longer term aspects that we're putting in place as well.
Thanks, Richard. That's helpful. And before I bring Sharon in, I just want to come back to something Lynette said, which was very constructive, I think, which was about how we communicate all these things. So, Owen, you've presented some really useful information about some really great progress and development we're making in primary care in the borough. And the question is always going to be about how do our residents know about this? And also, how do our residents understand the challenges? Of course, that won't mean that the goldfish you won't see in the house ever. But I think that's a really important point that she's made. I don't want to lose that. And that does speak to those questions that you've got up, which is how do we communicate well with residents and tell them what exactly is going on, what they can expect, what they can't expect, what's okay and what's not, and what's coming and what the future looks like. I think that's a challenge for us in the system, and a challenge for everyone here, I think, for us to think about that and answer that question. And I think it will help a lot. Sharon, you want to communicate?
Thanks very much, and thanks for your report, Alan. And I know some of the things that you are proposing to sort of mitigate the current problems are very much the result of some of the patient views that we've been feeding back to you at CCG level for some time now. And I just want to underline the importance of keeping on listening to patients as we try to deal with this, and also the importance of involving them in the solutions. They do have some quite good ideas from time to time, and that work that we are doing particularly in relation to primary care through the patient participation groups, is really quite important. And yeah, I think we're not going to be, my understanding, we're not going to be funded to carry on doing it at the moment, which is really a great pity, because we've got the system set up. We had a couple of really quite useful conferences involving the PPGs that are growing as we speak, which is what we need. We want to continue to do that. Likewise, we went and spent, we did a 24-hour shift involving volunteers at A&E at the North Mid, talking to people about why they had come and whether they'd tried other approaches beforehand. Now, that was a one-off 24-hour thing. We'd like to be able to do more of that and get the learning from those sorts of initiatives. And you talked about the new health centres that are coming on the street. That goes back to the time when we listened to patients some years ago, as you know. And we heard what patients were saying, and we looked at the stats and found how underprovided we were in the borough in terms of general practice. And likewise, we need to keep doing that. I've got a question in particular about whether we are ready for some of the increased populations that are going to come from some of the new housing developments that we have. We've got 1,700 units being built across the road there. People moving into those. I'm not quite sure where they're going to get their primary care from. I'm really not, because I think existing practices are busy enough without a whole load of new people, new patients coming along. So I think that's an issue we need to be thinking of, and there are other housing developments in the borough as well. Is our planning as it should be in terms of changes in the size of the population? The other issue I wanted to raise, and you mentioned this yourself, about the role that social prescribing can have in dealing or taking some of the load off of GPs. Now, as we know, money has been poured into this in an unprecedented way, from NHS England recently. And at Healthwatch, we actually employ quite a number of social prescribers now for primary care networks. But I do think there are questions to be asked about exactly what this activity comprises. Where does it start? Where does it finish? Certainly, the social prescribing, as I understood it some years ago, it's been an interesting one for some time, is actually, there's a big difference between what our social prescribers are doing and what I think social prescribers are. And there is a danger at the outside that it becomes a bit of a dumping ground for things that the GP can't deal with in some cases. So I think this needs to be looked at and defined, and I think people on both sides, both the practices and the social prescribers, we need to be working out a relationship here. Who is doing what? What exactly is this new profession, this new kind of work which we are dealing with, and what role does it have in the future scheme of things?
Thanks, as always, you bring us back to that most important thing, which is the voice of the patient, and I'm very grateful to you for doing that.
So I get on my point. Absolutely. Telephony. I understand there's a next wave of a mystery shopping report which will come our way in January. I don't want to be dishonest to the committee and say I'm looking forward to it, but we will act on it, and we will look. It will be a very important piece of work for us, and we'll act on it as we acted on the last one. And I think they're good to come to the collaborative and talk to all our GPs about that, present findings, and also the GPs. And the GPs were ringing up and actually asking about what it meant for their individual practice. So they're very interested in that sort of comparative data. The other thing is, you talked about the Healthwatch analysis of health needs. Is the Wellbeing project, the Tottenham Hale one, comes from a piece of work we did in, I think, 2014. So the day when that health centre is finally opening in October 2021, that's a big deal. On Wood Green, I noticed those buildings as well from that, and that new development, Wood Green Shopping City Health Centre, is something we really want to push, which would give us extra capacity in the area. Indeed. And then the links between ourselves and the planning department have been very important. We work very well with the council on a number of levels. The planning department, particularly on a couple of schemes, has been really helpful in working with us and private developers to make sure we had what we need to deliver healthcare. I do believe that these new buildings we're getting investment for, that's a large chunk of, gives us an immense ability to respond to future population growth with all that together. We also have 2 further coming, so because of the High Road West scheme, there's going to be another practice knocked down, but then rebuilt with a newer and bigger building, that's Tottenham Health Centre opposite Spurs. And so that's another example that we're going to have another practice.
And I think, and I'm conscious of time, I'm giving us plenty of time because this is a topic we've wanted to talk about for a long time. And we might not see Owen for a while again. But I don't want us to lose that point, which is that for there to be really good patient engagement, to repeat Sharon's point, there has to be that investment commitment. I'm not suggesting how we do that, but I guess she's made that really strong point that, and it speaks to my previous point, which is we're communicating out and how are we listening in, and those two, that's a vital process and a circular one. So that's a little challenge back to you, Erin, but we don't need a response to that.
Social prescribing.
And social prescribing, yes, thanks.
Yeah, and I'll take that away if I can. I think we need to be putting products reasonably regularly, but that's a good challenge. I'll take it away, and I'll also talk to the Federation who work this posted on workforce issues to make sure we have greater consistency. And talk to you, I'll talk to you offline. And Rachel's got a hand up.
Great, thanks, Rachel.
Just to mention on that, I think it's a really good point that we should be double checking how a social prescriber is being used, and also the kind of interconnections. We've got peer support workers, we've got social prescribers, some of them employed via Healthwatch Public Voice, others not. And I think we do need to just kind of map our current infrastructure and how it's working as a kind of precondition for building it up and being clear what the offer is. So we factored that into our inequalities fund work, and I was just speaking this morning with the team about doing exactly that. I think Paul is going to just lead a little bit of a kind of insight work stream into that, so that we really make sure that we're kind of building on best practice as we grow our social prescribing.
Thanks, Rachel, that's useful. And the trouble with chairing this meeting when you're all so amazing is I don't get word in edgeways, but that social prescribing connects slightly to a point that I wanted to ask about, but which you can come back perhaps later in writing even on, Owen, which is just around, as well as social prescribing, it's about the other people that are sitting around primary care. And we've talked a lot about navigators and how important it is that GP practices are connecting their patients in, for example, with our dementia service and Haynes. But also we're really concerned post-pandemic or during the pandemic, we suddenly saw a whole host of people who were carers who we in the council didn't know about, for instance. But we're pretty sure that GP knows them. Certainly they know that they're looking after mum and they're seeing that person with mum, for instance, who they're caring for. I'm really concerned that those people haven't been accessing networks, and we have some vibrant networks, and we're putting in more effort into looking at supporting people's mental well-being, for instance, helping them with respite, etc. But if we don't know about them, then we can't, and that will surely help primary care if those people don't present as much at the GP or at A&E or wherever else, because they're getting really good support in their community from the council, from the voluntary sector, etc. So just an appeal. I know lots of GP practices are really good at it, but there are places where we can improve on that front, and it being a really important strategic part of our work here. Mike, you had a question, and then I'm going to bring Jeffrey in, and then I might have to move us on.
Okay, yeah, Mike Coutts, Deputy Leader and Cabinet Member for Environment and Transport, which is sort of the reason why I'm in this, obviously the importance of environment to health. Zena mentioned anxiety, and I think that's something, I think there are two layers that have come out in this conversation to me, and one of them that Zena brought in was to do, I guess, what you could call integrated care anxiety. that is there in terms of understanding that system. And you do mention in your piece that the old primary care model is coming to an end, and of the small practices. And I think that does create some anxiety among people. I mean, you mentioned the Laurels Centre and Centene, and I think that idea of the private sector and commercial encroachment is a concern. And one of the keys there, it is connected to something that I want to bring up, another point in your presentation, but it is about that personal approach, and that personal interaction with the GP, the family GP, that idea. I mean, obviously, a lot of people's some of the most personal moments in their lives are shared with GP, other than their loved ones. So it is one of those areas where, I've had residents contact me who have been, upset by the fact that they've only been able to have telephone contact, for instance, during the pandemic, and that's been, very difficult to them and challenging. So it is, how we bring progress and innovation in a way that keeps some of those core elements, and those core elements being sort of facilitating communication and that personal relationship. So I was quite interested in that area, talking about effective triage in your piece. And there was a lot of talk about health anxieties that can lead to frustration, especially with parents with young children, for instance, who are very concerned about their health, which can lead to frustrations, can lead to them bad behaviour. So I think there's an element of that, but also leads to demand pressure. So that and that whole thing of being overworked. So when I saw embedding effective triage and the idea of the e-consult, I thought this is quite an interesting, a potential way in which you can bridge that old model to the new model, and also, deal with that demand, that increasing demand, in a way that is more personal than necessarily a telephone conversation. Right. So I'm just wondering how, where that is, where we are in that, and just one last question related to that is where that marries with the digital inclusion issue.
Yeah, I think that so I'll respond, and if I miss out a point, then come back to me, please. I think that, I work with most of the GPs across Haringey, and their values are deeply committed to patients. And let's bring that, and they're a group I'm proud to be associated with. So the two brothers GPs who are about to take over the building, which were Paul's and Curtis, they took over there. They grew up in the flat of their current premises on West Green Road. Took over from their dad, who's a GP, helped originally apparently when they were teenagers, became proper GPs in their own right. They're now the outstanding practice in North Central London, and they're going to have a big building that will serve up to 30,000 patients. Their values will be the same as the ones they took from their dad. And I think the values there, but the tools that are available to them to support their patients will be fundamentally different to the ones that their father was operating 20 or 30 years ago. So I think that's sort of my response. I think you're absolutely right on e-consult is the danger is it becomes a way for some people to come through the system. And we've actually been working with Health Watch on ways in which we can promote digital inclusion. And there are probably two main angles to it. There's something where we can enable people to access equipment digitally through particularly the mental health services that they would struggle to access otherwise, provided equipment in the Green Library. And that's been transformational for a few patients. It's early days, but absolutely. The other thing we're starting to develop is training for large numbers of patients on how to get their prescriptions repeated, how to use e-consults, but use it properly, and so you get more people able to use it effectively, recognising you'll still have a chunk of the population that won't be able to, but that will mean that there's more resource in the practice to help support them, rather than having endless calls about repeat prescription you could have taken away through the NHS app. And so, have I answered some of what you said?
No, definitely. I I mean, it'd be interesting to know a little bit more the reach of e-consult, and also sort of just that whole development of the tech development, like in terms of the patient themselves.
Can I suggest, that, just because I'm really conscious of time and I'm letting this conversation run because it's really useful, I think, but maybe we have that in writing. We've got a few things you're going to take away, and we'll come back if that's okay. I'm sorry, we're having a really good conversation. I think this is what the purpose of this board is really, but I want to bring Jeffrey in, and then we are going to have to move on to our next topic. Jeffrey.
Thank you, Chair, and I'm going to keep it quite quick. Jeff Rosen, Chief Executive, British Renewal Trust. I think, Owen, thank you very much for a good presentation. I'd like to add to what Councillor Brabazon said. I think it's not often you're here, but you did fantastic work over the COVID, so it's an opportunity for us to thank you. And as you know, you're a good friend of mine, but I think I just want to point out what the report could have done with, I think. And I think it builds on what Sharon was saying there, because I think it's a good report, but perhaps lacking in what resident perspective and what they're saying. So there's quite a bit from our NHS perspective, if you like. So it could have been good to know how we are in doing this, really trying to respond to what some of those residents are saying, I think. And Will made the point around thinking this as an opportunity to do something. And I think I would like to say it's something, for example, the primary care, how could they work more with the community, I think, and the wider services, I think, is an opportunity to try and bring that in, because the GPs alone cannot do it by themselves. We've seen that, I think. So how do we bring the other thing, whether the pharmacies, whether the community, whether social prescribing, the VCS, to make that model? And we talked about a new model of care, but we've talked about it in the form of single-handed and multi GPs coming together. Let's talk about a new model of care that brings in these other people in. I think that's where we need to take it from. And the last thing on staff training, by the way, again, I'm trying to put thing as a resident. I think staff should be well treated, I think, full stop, but there'll be situation, and we've seen evidences where people feel that they could have been treated better. So what are we doing to try and do the field who need a bit of support and training within the reception team? What are we doing for that? I didn't see that here. I think that's, I could have gone on the chair, but I'll leave it there. Thank you.
Thanks, Jeffrey. Thank you. They're really good points. And so I think, Owen, we're sending you off with a few things to think about. Strongly, I heard resident voice. I heard clarity on social prescribing. Those and how the GP practice sits in the community, how it brings in others and extends out, and how we make sure that we're connecting it. We're all here on this in this meeting. We're all from quite a few diverse organisations, and we know we need to connect better because we'll all be able to support each other. And there are a few other things, and Mike picked up on e-consult and how that's working in practice in a bit more detail. So I guess that's the homework. But we're going to move on now to the next topic because we've got a lot of other things to cover. But I just want to thank you, Owen. Thank you on behalf of the Health and Wellbeing Board, and to echo what's already been said, which is thank you. I know it's not easy. We all know that. We know that there are bigger challenges and that they're not all about what's happening in Harrogate. They're much bigger than that. But nonetheless, we want to keep pressing and pushing and trying harder. So thank you. Thanks very much.
Thanks.
Okay, so we're going to move on to our next item. And thank you. And I hope you don't mind. You will have noticed that I did let that run, but I did think it is an important topic. Primary care has come up and access come up a lot. I know it's a great concern to many of you all on the board and in the meeting here. So we've had a bit more time on that. But we're moving on to item 9, special educational needs and disabilities, the inspection and a written statement of action. And I think, Anne, you're going to introduce this.
Thank you, Councillor. I'm not going to spend too long introducing it because Jackie has a presentation and no doubt we'll want some discussion. But just to say that colleagues around the room will remember that this was our long-awaited SEND inspection. I think by the time we were inspected, we were one of maybe 4 left in London. Since then, I think there's probably just 1 left in London and they await the call every week. So this is the outcome of our letter. that we've now received, and we're required to produce a written statement of action to do with significant issues 70 days after receipt of the letter. And so Jackie's here to present that. I should say that this is a health and social care partnership work, and so we were inspected by Ofsted and the CQC. So Rachel too is online for this too. Thank you. And Chair, if you don't mind, I'll hand straight over to Jackie.
Thanks, Anne. Jackie, go ahead.
Thank you. So I'm really conscious that some of you in the room may have seen this presentation already, so hopefully it won't be too repetitive for you. But as Anne said, it's just a high-level summary really in terms of what the inspection found and what our response is to that to date. So in terms of the, just make sure it's moving. In terms of the inspection itself, the areas of focus were absolutely around how well do we identify children and young people with SEND, how well are we supporting the needs of those children with SEND in terms of meeting their outcomes, and how are we improving outcomes for children. Our inspection took place on the 5th to the 9th of July, and our report was published on the 8th of October. And I'm sure you'll all be aware that we were then required to produce a written statement of action. In terms of the areas of strength, these were the ones that they absolutely saw. So I think it was really pleasing.
Sorry, Jackie.
I think we've lost the presentation.
Oh, apologies. Let me just get it back up.
Oh, thank you.
Is that up now? Yes. Okay.
Yes.
Sorry about that. So in terms of the areas of strength, I think the thing that we were all really pleased to see is that Ofsted and CQC clearly said that we knew ourselves well. So the self-assessment was very robust. It clearly identified what it is that we thought we needed to do in Haringey in terms of a systemic approach. It did say that, you know, that we do have effective joint commissioning arrangements, so we know what we need to commission, and those arrangements were robust and in place, and we worked very well as a partnership. That we were starting to develop a culture of learning and listening, and they could see those green shoots that the leadership team was starting to make a difference. It was it's good to point out as well that they noted that within Haringey, children with SEND, their education outcomes are strong, and SENCOs in particular are knowledgeable and skilled. But there are some areas of high that we absolutely must achieve. So these are the actions that we have to address. So the poor quality of our education healthcare plans, both in terms of compliance within timescales, but also the quality of those, and our annual reviews, particularly for young people who are transitioning to adulthood. Our partnership working is strong, but our partnership in co-production communication with parents is significantly weak, and that's an area that we absolutely have to improve, and that includes making sure that our local offer has all the information on it and is accessible. And our third key action is to address the unacceptable waiting times for a diagnosis of autism, and also the support that's offered to families whilst they're waiting for that diagnosis. Whilst these are three key recommendations from the inspection, this is a part of a wider piece of work that we have to do within SEND improvement. So this is alongside our SEND strategy, which is much wider than the areas of focus that I'm talking about today. So in terms of actions and timescales, we have 70 days to produce the written statement of action. So that takes us to the 11th of January. But the work hasn't just started since we've been inspected. So this work started long before CQC and Ofsted came to us. And it started with us developing, you know, the robust and established SEND executive, the appointment of permanent posts such as myself and Mary Jarrett, who's the head of service, who started it in March, but also our robust self-evaluation and our draft SEND strategy, all of which has informed the written statement of action to date. We will also be going to a number of forums, and we've been going to boards such as today to talk about the inspection, to give you an update on the work that we're doing to address these actions, and to invite you to be part of this work going forward. In terms of key actions already taken, like I said, you know, the written statement of action has very much been based on our self-assessment and the draft SEND strategy, which has been out for consultation. We also had a series of conversation events in the summer with parents, so 5 of those that also informed the priorities that you see in front of you today. So the work that you can see on the screen is work that has happened across the last 12 months or so. And if I just choose a couple of those to share with you, in particular, against those priorities. I mean, under priority 1, we've increased our statutory assessment team by 100%. So we've gone from 6 case officers to 12. So that's focusing on making sure that plans and annual reviews are completed within timescale, but also that the quality is is much improved. We've employed a full-time SEND communications officer who started with us in October, and their focus is really around developing a communications protocol, improving our local offer, our outreach to families, so as many families can access information and be involved in work, but also our SEND newsletter, which I do believe is much improved. We've commissioned the Bridge Renewal Trust to support our Haringey Parent Carer Forum, and that is now established. It's great to see Jeffrey on the call. I think we've got between 9 to 12 parents on that group now, and we're starting to do the work around being clear about their roles and responsibilities and how they will represent the wider voice of parents and carers across Haringey. And we've also insourced our travel buddies team. That team went live in September. Very smooth implementation, a key focus on supporting young people to travel to their place of learning independently and safely, and very much a part of our preparation for adulthood strategy. So these are the 5 key outcomes that we expect to achieve as a result of delivering this written statement of action, which is part of the SEND strategy. There will be a strong focus on outcomes. It very much will be around how do we know that we're making a difference? What is it that we see? What is it that families tell us? And we'll have measurable key performance indicators with leads and timescales that are realistic. In terms of planning, this work we expect to take between 18 months to 2 years. So it's a piece of work that will happen over time with a phased incremental approach. However, there are some areas of action that we will be addressing much more imminently. And I think the important thing to say as part of planning is that to truly make the difference, it has to be about shared accountability and ownership. So this isn't just about improvement within the SEND service. This is about systemic change across SEND services, for children and young people and their families. We've been really clear about creating that cultural change, which will take some time because we know that there has been a high level of dissatisfaction from parents across Haringey in particular. But we're also starting to see those green shoots of positive comments and interaction with the service in terms of taking this agenda forward. So to support the written statement of action, we do have a draft. We have a draft because it's informed by our SEND strategy and our self-assessment, but we've been doing lots of work with parents, carers, stakeholders such as yourself to really think about how this should work and how it can achieve the outcomes that we want it to do. We also have 2 workshops that are taking place on Monday and Tuesday of next week. Those workshops are co-delivered with representatives from the Parent Carer Forum, and they're focused on the 3 inspection areas that you see in front of you today. In terms of the workshops, we'll be sharing our thinking to date. We'll be hearing from stakeholders around how we think we can make the difference, what are any new actions that we haven't yet considered, and how they can be part of that work going forward. In terms of the workshops themselves, we have deliberately kept them small because we want them to be focused and meaningful. So we've allocated 15 places per workshop. So that will be 90 places in total over the 2 days. And they've been open to all partners and parents and carers. And I know as of today that certainly Monday's fully booked and Tuesday's almost fully booked. So we've got good representation on those workshops. We also provided a pre-workshop questionnaire so that anyone could provide any feedback about any of the priorities, and we didn't lose any of that thinking. And this is just the start. This is about how we clearly outline our written statement of action, but going forward, we'll be continuing this work through task and finish groups because parents and carers have clearly told us that they want to be involved in this in terms of an improvement journey going forward. And then in terms of the role of the SEND executive, so the SEND executive is a standalone board that's responsible for ensuring that they deliver against the written statement of action. So we will be providing, they will sign off the final version of the written statement of action, and they will be receiving regular progress reports on this at each of their meetings. We will also publish this on our local offer, and we will share regular progress updates with our Parent Carer Forum. We also have representatives of the Parent Carer Forum on our SEND executive too. We intend to publish an annual progress report on our local offer, but we'll also regularly through the SEND newsletter to do that whole model of you said we did so that we can keep people regularly updated. The SEND strategy consultation has recently closed and we're in the process of collating that feedback, and we'll be publishing a consultation summary in the December newsletter. The intention is that that SEND strategy will be finalised and working its way through the governance boards, through to scrutiny in March, and will be published in March. And it's good timing because it means that anything else that comes out of the workshops next week, we can also use that to inform the strategy moving forward. that point, I'll stop for any questions.
Thanks, Jackie. So I'm going to take briefly some questions, but the first thing I was going to suggest is that it might then, thinking about the timeframes and looking at when we might meet again, it might be good to hear back from you in March, if that sounds reasonable, given the other things that might be going on. Do we have any questions? I also want to give Zena the opportunity if she wants to come in and say anything.
Thanks, Lucia. I mean, I think this is a joint enterprise with health, and so it's obvious. I mean, I'm saying things that are cliched. It's timely and proper. This should come to this Wellbeing Board, and I don't think we can deliver anything for children with SEND without the full engagement of the health partners, of whom there are many and in many different guises. So that is really important for us in the written statements of action. I think if we get SEND right, it's probably likely we'll get most other things right, because it's one of those really difficult areas where communication with families is so intense. And I'm sure that cuts across from health into education, because people's own trauma of their own experience, and what we know are people battling against bureaucracies. It's true, they do, but we come with an approach which is to try and mitigate, to change that if we can, which means working with people and enabling and respecting what people say, listening to what they say, and working collaboratively to make the changes. You can't deliver an SEND service or a programme without working with the families. It's nonsense. You can't do it to people, you have to do it with people. And I think that is our main driver. So for us, it is critical that this Parent Carer Forum operates independently, that they are knowledgeable, that they operate on not just emotion, but also on some facts and some understanding. And some of those messages are quite difficult to impart to people, because your personal experience colours what you think is going on for everybody else. But in the forum, people are representing a large group of people and not just their own case. But I understand the need for parents to talk about their circumstances. And many of us in this room, in our families, have experience of this. And it shapes how you see things. So I just think we've got to get it right. We've got to be open in working with the families. We have to build the trust. We have to rebuild trust where it is broken down. And I can only say that I've been deeply impressed by the team's commitment. I'm talking the SEND team commitment to driving that approach and that model of working. So I'll leave it there. I'm happy to answer any questions as lead member. I know where I want us to be, and we're talking about this, I imagine, I don't know, 5 times a week or something. We talk about SEN all the time because it is such a massive issue. And we have got a lot of work to do, but I'm confident that we will be having a good written statement of action, which will be consulted with parents and carers and yourselves.
Thanks, Zena. Thanks. And we've talked so many times about how important it is that when we talk about co-production, how important it is that we invest in people so that they can co-produce with us well. And that's a really important part of it, isn't it? Part of that journey. And Sharon, you want to come in?
Yeah, thanks for the presentation, and I wish you well in the work that you're doing to try to address this very serious issue, which is a result of, I think, historic failures on the part of the council and associated services. But I do feel obliged to report back from a meeting that I chaired recently of parents affected by this issue. And I've chaired an awful lot of meetings of patients and service users in my time, but I've never chaired a meeting where there was so much anger about both the historic neglect they felt of the circumstances over a long period of time. But also anger about the manner of the response to the report. There's a huge amount of anger about what they saw as a lack of consultation in the way in which the report should be responded to. They felt they hadn't been told much about the Parent Care Forum, that the meetings had been arranged with very little notice given their circumstances. They point out quite rightly that they need to have advance notice to make caring arrangements if they're going to turn up to such meetings. I don't know the full details of it, but I can tell you we've got some very, very angry parents out there about this, and the more you can do to really engage with them, all of them, in a timely and appropriate way, the better the outcome, I hope, will be going forward.
Thanks, Sharon. You know, I think it's been talked about in other circles as truth and reconciliation, and I think that's right, isn't it? Exactly. And I think we all acknowledge the challenges, and that goes for all sorts of things happening in all our services. Sometimes things go wrong, and it takes a lot of investment to rebuild relationships. And do you want to come in, and then I think I need to move us on to our next topic.
Thank you. I think someone had their hand up. I think it might have been Richard, and it's now gone down in case Richard wanted to come back. Thank you, Jackie. Thank you, Sharon and Councillor Brabazon. Just wanted to say that we do acknowledge, as has been said in the room in the presentation, that, and has been said, you know, by those who've spoken, that this is historic issues, and we are working for improvement. We don't want to be complacent about that. We don't want to you know, assume that things are right. We don't. And we know that this has impacted individually on people's lives over the time. Some of us were in the room at committee last week, and people were speaking not of recent times like 2, 3, 4, 5, 6 years. People were talking about decades, and so that's the communication and the trust and the confidence that we need to build on. I have to say that the only way I think that we can do that is with the support of everybody, you know, contributing to the work that we do co-productively, moving us forward. There has been additional investment, but additional investment alone isn't going to cut it. Some of the issues that were raised, although people speak of the SEND team, are not actually about the SEND team. They are about the environment, such as dropped curbs and access to buildings. And so that was, you know, we really do want to expand this corporately and borough-wide, so that, I think somebody said earlier in the room, you know, that children are not compartmentalized, they live in the community environment, and so we will be developing our plans on an ongoing basis to keep on improving them, so we get best outcomes for children and young people. Okay, thank you, Chair.
Councillor Brabazon, I'm conscious of time, so I'm going to bring you in briefly, and I'll comment in the chat that I can share.
Yeah, I listened very hard, Sharon, to what you said, and I think I've experienced personally a lot of the anger that people feel, and have tried to respond respectfully and in a way which tries to build a bit more trust. I just want to say a couple of things though. Regarding the Parent Care Forum, I just want to make the point that we have funded the bridge in order to deliver that. And Jeffrey is here on the call and might want to say a word or two about that, because some of the references which you might have heard, and I do think I want to set the record straight on this, about notice for meetings were a lot to do with the Parent Care Forum. So Jeffrey and I have we talked about this, but I do think sometimes it's important to know some of the backstory, if you like, because the council is always easy to bash. And sometimes it's justified, but sometimes it isn't. But we have taken on board, we have taken absolutely on board. I recognise you have to give people a lot of notice, of course you do. And any meetings must be held really at times which are best for people. And if we're going to be in public, in meeting in person, in venues in venues which are accessible and have all the capacity to accommodate people's needs. So I do think we recognise that. I want to make the point again that we've moved 1 million miles from when I was lead member, which sort of ended in 2020, when Anne and I were talking about the need to change special needs, to where we are. There has been a massive sea change. So I do think we must carry parents with us. We have to listen to what people say, but we also have to be able, as the Quakers say, you have to be able to speak truth to power. You do, that's true. And we also have to be able to share some of the issues that we're tackling as we move forward, because it's not going to change overnight, but it is moving definitely in the right direction. And I know, for example, Jonathan, who was at the meeting Anne is referring to the other day, I know that the Whittington listened very hard to many of the comments that were made and have made many of the changes that were recommended. There's always more to do, but I do think that this is an area where working with people is critical, but has its own tensions.
Thank you, Councillor. And I think I am going to move us on because I'm really conscious of time, and we've got quite a few things and we could talk quite at length. I'm just going to say that Jonathan's put in the chat his emphasis on the collaboration between health and the council being crucial, and he's reassuring us that Whittington and the council are working very closely on these issues. And I think we all recognise actually that the co-production journey takes a lot of time, takes a lot of learning, and it's constant learning on both sides. And what I think I'd like to say is we're going to come back, and you're going to come back to us in March, and I think we're confident you're going to come back and have a good story to tell, and it will be a story of learning, of moving forward, and some challenges, and the story of honesty. So that's what I'd like to do, and move on to the next item, if that's okay. And thank you all. I know we could talk about this for a lot longer, but there are a few other things we have to. And I think we should just acknowledge that it's not easy, but we know that you're working hard. So more power to your elbow, all of you, and thank you. And I'm going to move us on to item 10. And Catherine and Georgie, I think. Is that right? No.
I think it's seminar feedback.
Get the wrong notes, apologies. In fact, I'm going to suggest that we vary the agenda, because I'm conscious of time and a little concerned about we moved things around. We tried something different to give us a bit more time to talk about the meaty topics, which I think was the right thing to do. But I'm actually thinking that we've got Paul is here, and I'm actually thinking about taking item 13, the Better Care Fund submission. Let's take that now. Is that okay, Paul? Do you?
Absolutely, yes, yes. I'm with you, everybody.
Let's get that first, and then we'll we'll come back.
Okay, I'm going to do a whistle stop tour because I know your time's precious. So this is an annual submission that we take to the Health and Wellbeing Board, which is the Better Care Fund Plan. So that's a national programme underpinned through a Section 75 agreement to describe and fund integration of services between health and social care at the local level. So it's actually the 21-22 version of it. And you must be wondering, why on earth is it coming in kind of November, at the end of November in 2021? The guidance was actually released by the government quite late, at the end of September, and we had to submit a plan, a set of metrics, and a breakdown of our investments by the 16th of November. So we didn't have a lot of time, and the government always recognises that actually there are times when there's delegated authority through the Director of Health, Adult Social Care, kind of takes forward that on behalf of the Health and Wellbeing Board. But there is always a requirement to submit the Better Care Fund Plan to the Health and Wellbeing Board, which is what this proposal does. So I just wanted to pull out one or two things around it. I mean, particularly this is the first year that for several years that we've been asked by the government to provide a narrative around the Better Care Fund plan. And I'm glad to say that we've been able to pull together and address 3 challenges, which I think you would recognise and is certainly in play nationally. One of which is the need to clearly respond to the legacy of the pandemic in the remainder of this year and also next year as well. And that means actually managing a greater number of people whose health status and conditions have worsened during the pandemic. And there's a lot of evidence to suggest, as colleagues will know, how busy our kind of health system is running and social care system is running at the moment. There is therefore leading me on seamlessly into kind of ensuring that the out-of-hospital systems are well prepared for increased activity in local trusts to facilitate hospital discharge in the winter. And then the third thing, which is kind of a balancing element, if you like, is to ensure that we address some of the underlying issues associated with equity of access, outcomes and experience, and the resources to level to need across North Central London and within the borough as a whole. And that's to address some of the longer term issues we see in terms of social gradients of health, particularly around differentials in healthy life expectancy between more affluent and least affluent populations or underserved groups as well. So if you like, the BCF plan hopes to balance things in the here and now, which are things associated with hospital discharge and you know that idea of managing people and helping them recover as far as possible, with the idea of actually investing in early help and prevention. So without kind of going through all the details in the narrative plan, which people can read about, that we kind of hope we're going to be able to use the Better Care Fund plan around something called the Care Code, which I'll explain in a second, to achieve 2 kind of objectives, one of which is to ensure that the right joined up solutions for the right person are delivered at the right time. And then the second one is clearly to help people recover from or avoid even better kind of future health and social care crises. And you know, there's a whole variety of mechanisms to do that, which I'll come on to later. So within the kind of the narrative that we've kind of created, we've kind of got a care cone approach, which kind of stratifies the levels of need and the responses to those needs across the population, ranging from kind of people feeling healthy, safe and well, which is the general kind of universal offer that we can all do about looking after ourselves in terms of public health messages. But the Better Care Fund plan focuses on 3 specific areas of investment in particular, one of which I've already mentioned, which is about early help and prevention. And we're really describing within the narrative something we're really excited about, which is the Healthy Neighbourhoods collaboration as part of that locality working that we're developing between the statutory and voluntary sector. And the BCF plan is placing some money in that scheme alongside quite a substantial contribution from the CCG in terms of its inequalities fund, aimed at kind of levelling to need across NCL. So that Healthy Neighbourhoods Collaborative is starting within the east of the borough, but obviously if it's a successful approach, we would want to extend it to other parts of the borough as well. We're also kind of describing anticipatory care and support, which is support for people who've got more substantial and complex needs and often need a tailored and integrated and multidisciplinary response to those needs. And during the course of this year in particular, we stood up 2 really exciting initiatives which have been really well received. Multi-agency care and coordination team, which manages people with frailty and multimorbidity who've got more complex needs and proactively identifies those individuals. And also an enhanced health care in care homes development, which is about supporting kind of care home residents. Both of those are requirements within from the government in terms of their Ageing Well Fund. So again, the BCF plan isn't the only financial investment that's being placed in those solutions, but it is quite a key one, the Better Care Fund plan. And then the final kind of area that we also want to invest in, clearly, as I've mentioned before, is helping people recover after they've had a crisis, particularly coming out of hospital. So what we've got within the report basically is a description of the investments and the plan that we've kind of got around standing up some of those solutions. It also talks a great deal about issues around equity of access and outcomes and experience, and our real focus on really starting that kind of a level of co-production and engagement with local communities and underserved groups to really understand how we can best support some of those groups in a more intelligent way, in a way that's better tailored around the community and their needs. And final thing I would say about the plan is it also tries to describe how we can, I suppose, structure what I would describe as a multi-geographical footprint between the kind of the community, the locality, the borough level, and then North Central London as a whole, so that it looks like a coherent picture of support. So I just wanted to finish off very quickly by just saying one or two kind of key things that have happened, because I think they're really important. So our hospitals are really busy at the moment, but actually during the course of the pandemic, we've seen those hospitals perform, really well, and actually we've seen more people being discharged from hospital earlier, and it's decreased by a significant amount, and there are some stats within that as well. But that also means that we've helped more people recover after crises as well. And again, the report describes some of what we call our reablement episodes, the ability to kind of get people to recover, to undertake daily living tasks. We've seen about a 15% increase on that, particularly during the kind of the period of the waves that we saw during the pandemic. There was a large number of people needing that level of support. So I think I'm going to just giving you time. I mean, the last thing to say is we've also seen more people who can be supported without coming to hospital, if you like, by taking rapid response and an emergency and a crisis response to their homes to try and treat them. So we've seen a 40% increase in the total number of patients we've seen each month. So I'm just going to pause there. That was a quick whistle-stop tour. The point of taking it here is clearly to sign it off, but also for you to, I suppose, within the report, we're kind of talking in section 6 about the fact that we've invested a certain level quantum of funding in those variety of different things I've just described. And there's a requirement statutorily for us to spend a certain minimum spend on what's described as adult social care spend, which for 21-22 is £6.9 million, and on out of hospital spend, which we're well above the minimum requirement for that as well. So within the report on kind of paragraph 6.6 and table 2, we've described our total quantum of investment to ensure that you're reassured that we're meeting the requirements within the kind of the Better Care Fund plan. So I'm just going to pause there. I'm happy to take any questions.
Thanks, Paul. And can I just do something before we have a discussion, have some questions, unless there's something. What I'd like to do is, because I'm conscious that we're going to remain for it, and one of my colleagues here in the room will be leaving bang on for it. And in case we don't, and I know we have a duty here so what I'm asking is everyone broadly happy to accept the submission as it stands? And can I have your agreement on that? I know we'll have a discussion and any questions, and also follow up anything earlier. So if I could just have that agreement from you, that would be helpful. Thank you. Okay, so that's helpful. That just makes sure we've done our duty in the right time. And Anne, you've got your hand up.
Thank you, Paul, for the presentation, and thank you, Councillor Desnes. Absolutely accepting the premise of the Better Care Fund. I did look down the table to see what the percentage spending on children was, only to see that there wasn't a line for children. I just wonder whether going forward, accepting the criteria and all that, whether that's something that we could consider looking at going forward, because early intervention for children and young people actually takes us into, is a benefit for the community as a whole. And there might be areas that we can look at going forward. Thank you.
Thanks, Anne. And Paul, do you want to come back on that?
Yeah, I mean, predominantly, as you know, the Better Care Fund plan is kind of aimed at a somewhat older age group. But I do know that there are some areas and some opportunities to think about that. I suppose having a dual investment in it, we wouldn't want to rule that out. And the one, I was on a presentation that this afternoon about violence against women and girls, for example, where you could clearly see that's a whole family issue, isn't it? So there are some opportunities to identify where we could identify that in the future. And clearly that issue around the early help and prevention and the healthy neighbourhoods is designed to be full population wide, as you know. So yeah, I wouldn't rule that out in the future.
Thanks, Paul. And I think it's useful, and it is about that whole family approach to quite a few things there. So touche, Anne, right, I can see that. But I think quite a lot of what we've got there will touch bigger groupings. Are there any other questions? Anyone else want to come in? Comments or questions? No. Okay. All right. Well, thank you, Paul, for bringing that to us. We've discharged our duty. We've got a few moments, and I wonder if, of the items that we have remaining, whether or not just a quick feedback from our seminar, our last seminar on ICS, if we could do that, I think that would be really useful. I don't know, Rachel or Charlotte,
Okay, shall I make a start? So thank you, Chair, and just remind everyone that there was the second of our seminar series, which we're holding over the coming months to reflect on sort of the development of the local care arrangements, and also the our sort of voice in, as it were, to the integrated care system arrangements at sub-regional level as well. So we looked back over what we'd agreed previously and the areas of priority that we want to take forward. We had a very good discussion, an in-depth discussion around co-production, so really interesting to think about that in the context of today's conversation, and how we really make sure that we do build it into everything that we're doing, and however challenging and at times difficult that is, that it is just a core part of what we need to do. And I think we've seen it reflected through the SEND inspection paper, but also through the primary care paper about how do we communicate, how do we engage, and how do we co-produce. I think some of the work that came out of that was developing a way of working that we can all sign up to, a sort of framework type agreement that we need to do a bit more work on, and we committed to coming back with some ideas around that. I think for future seminars, we want to keep this iterative approach of going back over what we've done but lead it forward. I think some of the areas we want to pull on are sort of what are the things we most want to keep very locally, borough-wide, and thinking about our sort of relationship with the integrated care system. But equally, I think we want to find ways to have a bit of a stock take and interact a little bit more around some of the things that we really want to focus on next. So, Rachel, is there anything you want to add about the sort of forthcoming seminar that you want to pull out?
So just to say about the forthcoming seminar, we've got the Leadership Centre and Traverse, who are working with borough partnerships around their development needs in order to kind of get us to a strong position, or as strong as we can be, for April, when we have a kind of statutory role. And so I think what we're going to be doing is looking back at the things that within our borough partnership, we're fairly well organised. We have a delivery plan. We have our priorities and our structures. We've identified through the previous health and wellbeing workshops, we've reiterated some of those areas of focus, and I think we've dwelt a bit more on things like workforce and so we will take those, and then we will do a bit of an examination to check how do we make the most of the resources that we've got as a group of organisations in order to take forward our priorities, and where will it take us? What do we need in terms of our architecture? So that's both our people and our kind of resources for co-production and our governance and our decision making. So we will just, I think, through the next seminar, and it might take us a couple, we will do that kind of cross-check about our priorities and how we're set up to deliver them. Thanks.
Thank you, Rachel and Charlotte. That's really helpful. And workforce, we've talked about that so much at these meetings. We've talked about it quite a lot today. So we've got real focus, I think, so real focus in our minds. So thank you. I'm going to suggest that we, and apologies to Geoffrey and also Will, but I'm just going to suggest, I know that you both will have some material that we could circulate to the board just for a little update on vaccines and where we are in the borough. and also Jeffrey and Charlotte on our work to tackle racism and inequalities. And we've had some very fulsome updates at previous meetings, and I'm sure we will do next time. But if we could just circulate something for members of the group in the meantime, that would be helpful. I'm sure you will have a presentation up your sleeve, and we'll always do on the latest. And I think we've arrived at the end of the meeting, and I want to thank you all. And we tried something different and I've tried to give space to the things that I think I know are the hot topics we want to talk about. But that doesn't mean we can't talk about everything in 2 hours. So there you go. I'm happy if anyone wants to give me feedback directly on today, how we've done it. We've done it differently and how we can do it better. Very much so. Just let me know. And thank you all very much for your contributions. And we will see you next in January. I believe it is January the 26th. So look forward to it and to seeing you all, probably some of you tomorrow, actually. Thanks very much.
Thank you.
Bye-bye.
Thank you, Chair.
Thank you.
See you at the expo.
Thank you, Lucia.
Expo.
Very good. Thank you.
Bye bye.
That was Jeffrey. That's the racism increasing.
Yes. Yes.
I couldn't hear.
Yeah.
I certainly can't see the presentation.
Yes.
I couldn't get online. That's just in papers. I mean,
Yeah. No, I know.
This is
It's
on
not.
the long conversation we've done.
Yeah.
At various points, there were lots of
They were really complaining about it.
It might be useful to talk to
meeting
together.
house.
I'm not coming again in the middle of winter to see.
No,
We
no.
have that in an email.
Pneumonia.
Lots of kind of getting.
Yeah, it's. I think this does need to be addressed urgently. Actually,
You're all right anyway.
Good.
Thanks.
Yeah, I'm just about to get on the road.
Yeah, I think this. I was doing that thing you do where you don't think.
Bye-bye.
Thanks, Naz. Thanks, Lucia.
Thanks, Mike.